May I request now Mrs. Eddie Engstrom to come again and discuss about skin care during radiotherapy. Please.
Thank you. All right. So we'll get into the skincare. We talked about radiation therapy and what it does to damage the cells. The normal healthy cells get damaged as well. And so let's talk a little bit about what we see with that. The way we grade our radiation dermatitis, we use the CTEP, the Cancer Therapy Evaluation Program, version 2 toxicity grading criteria. Our nurses are all trained in this criteria. This is not just for dermatitis, but it's for all toxicities, both for radiation and for chemotherapy. There are toxicity gradings. So it's very helpful that we have something very specific that we can look at and know exactly what we're talking about, and we're not just making assumptions about what we're dealing with and treating. So this is very, very helpful. We go from grade 1, which is very faint erythema, dry desquamation, which is just some peeling of the skin, to more moderate brisk erythema, may have some small areas of moist peeling. Typically, we see those in creases or folds of the skin under the breast, under the abdomen, those sorts of areas. When we get into grade 3, we have larger areas of moist desquamation where the skin is peeling and it's moist, and we may have some pitting edema. And then we get into grade 4, this is where we start seeing really that skin necrosis, the ulceration, very deep ulceration, typically some bleeding, that sort of thing. I have to say, with the advances in radiation therapy that we've had over the last several years, it is very seldom that we actually see these grade 4, even the grade 3 toxicities for skin. So that's really been wonderful. It used to be a really big problem. Common reactions that we see to the breast can range anywhere from a grade 1 all the way up to a grade 3 or 4. And that goes with what I was saying. We really don't see those grade 3, 4s as much anymore with the improvements in the delivery of radiation therapy systems. Grade 1, 2 is the most common, and we can manage that very easily here in the clinic and teach patients how to manage that. Our lung patients will typically have a grade 1 or 2 erythema, mostly grade 1 erythemas, and that's typically seen on the back rather than on the chest because that's where the exit dose happens, and that's where we see the majority of that reaction. Our head and neck cancer patients, their erythema can range from a grade 1 all the way up to a grade 3 or 4 if they're receiving concomitant chemotherapy as well. Again, that's also changed over the last many years. More of those patients are receiving immunotherapies as opposed to chemotherapies. And that has improved those toxicities from to the skin. So some of the things that we can do to prevent some of these skin toxicities have to do with teaching our patients to keep their skin clean and dry. We want to make sure that any areas where we have folds in the skin are free of moisture. We'll sometimes recommend that patients just dust plain cornstarch in those areas just to keep them dry. We don't want to use things like talcum powder, or some people have used in the past things like deodorants that they've put on the skin, and this can actually increase irritation. So something just like a plain cornstarch that can be dusted on the skin can be helpful in those areas where we have creases or folds in the skin. We do not want our patients to put any kind of product on their skin within 4 hours before their treatment. We don't want to have any type of product on the skin, moisturizing product on the skin at the time of treatment. Anecdotally, we know that this can potentially create a bolus effect, which could increase the dose of radiation at the surface of the skin and therefore increase toxicities. Again, this is an anecdotal. There's not been a lot of data to support that, but we do see it in the clinics on occasion when patients don't follow those directions and they put moisturizers on their skin before they come in. We also recommend that patients avoid any types of perfumes or alcohols in their skincare products. Those types of products can increase irritation. And we'd also rather that they not try something new to that area, as their skin may be more sensitive. And so we don't want that to cause other irritation and have difficulty deciding if the irritation is from the radiation or from another skincare product. As far as nursing interventions go, they're really very simple. We try and keep it easy. Patients can follow these. They work well. If you're going to have an irritation to the skin, you're going to have erythema, it's going to happen. And we just need to do our best to keep that skin intact and prevent any infection in that area. A gentle soap and tepid water is best. Rubbing or scrubbing in the area that we're treating. We really want to be very gentle to our skin as it's irritated. Gentle soaps, we just want something that doesn't have any kind of harsh chemicals like lye or antibacterial type soaps, anything with an abrasive in it, those sorts of things, any sort of exfoliant, whether it's chemical or physical exfoliants. We just want something very simple. And again, not using excessively hot or really cold water, just a very tepid water is most helpful. We typically recommend that patients avoid any type of shaving in the area that's being treated. That the shaving, especially from straight or safety razors, can cause more irritation to the skin, as can the products that are typically used when patients are shaving. So we try to just avoid shaving during that time. Any hair that's in the area that's being treated is going to eventually come out anyway from the radiation. So if they can just get to that point, they usually do just fine. Some of the products that we typically recommend to our patients, plain aloe vera gel is one of the best things to use. It's moisturizing. It doesn't leave a residue or an oil on the skin surface. And it works very well in soothing the skin. Patients can actually put that in the refrigerator and use it cold. I've had patients try and put it in the freezer, and that's too cold. So in the refrigerator is usually okay to keep it cold, and they can use that on the skin. It doesn't stay cold for very long, but it can be very soothing, and it doesn't cause any problems. Coconut oil is a fabulous product. Most everybody in the world has access to coconut oil. It's very simple. Coconut oil is known to have antibacterial, antiviral, and antifungal properties. So that can be helpful to keep the skin moisturized and happy. Calendula is another product. It's a plant that creates a good moisture barrier, and it absorbs well into the skin. And has been shown, we've had some studies that have shown some benefit to using calendula. Another product that I did not put on here is lanolin. Plain pure lanolin is another excellent product that absorbs well into the skin and does provide that deeper moisture. Really works well for these patients, especially for breast patients. We also recommend that patients wear loose-fitting cotton clothing that allows air to circulate around the area that's being treated. This will also help with healing of the skin. We want to avoid the sun as much as possible. Keep the area that's being treated covered from the sun, and use sunscreen in that area if you need to be outside, and if if the area that's being treated is going to be exposed to the sun, definitely use sunscreen. And again, if you're using sunscreen, we want to make sure that sunscreen is off the skin um, within 4 hours prior to the radiation, as we know sunscreens stay on the surface of the skin, and we can create that bolus effect of the radiation. So we don't want to do that. And we also want to avoid extreme temperatures like hot or cold packs to the skin. We don't want to do that, as that can also damage. The nerves are not as sensitive and can't tell us that it's too cold or too hot sometimes, and we can end up creating a burn from the extreme heat or cold. So we want to avoid that. Um, so those are quick tips. I know we're short on time, so I just wanted to answer those for you real quick. Do we have questions? Anything I can help answer that would be helpful to you? Questions about what we do here?
Thank you very much, Emily Armstrong, for the nice, excellent presentation on how to take care of the skin during radiotherapy.
Sure.
So the session is open for question and answer. If they are not there, then we can start the next session. Dr. Lalit?
I think coconut oil application she has suggested is universally available, and even in resource limited settings, this is very useful. And my radiation colleagues will agree to that helps in most of these patients. So she has covered, I think, the topic very well. And thank you, Emily. Thank you so much.